Welcome. My name is Unity Stoakes, co-founder at Startup Health, and today I get to speak with one of our health transformers, CEO of Access TeleCare, Josh DeTillio. We're going to be learning about their extraordinary run, how quickly they've been growing, and really how they're changing the landscape of how specialty care gets delivered across the United States by delivering telehealth solutions for health systems and providers all over the nation to really help people in urban centers, regional areas, as well as remote areas, really making a transformative impact on how people get access to the care they need, even within the health systems. Stick around for this conversation with Josh DeTillio. Welcome. I am here today with Josh DeTillio, the CEO of Access TeleCare. I am so excited to catch up with you again because you guys have just been really on a tear. You've been growing so much at Access TeleCare, but just for the audience, it'd be helpful just to remind everyone what Access TeleCare is, who you serve. Let's just give the frame to set the stage.
I appreciate the time. And at Access TeleCare, we are the largest and oldest acute care telehealth company. We've been in business over 20 years, and we've helped a lot of patients and a lot of hospitals continue to thrive. And we're unique because we have 8 different service lines. A lot of telehealth companies are single specialty, but we're able to bring a lot of solutions to a hospital, especially rural hospitals where they do have a big need for a number of service lines. And we really help hospitals retain their admissions and limit transfers and continue to be financially viable.
It's really such an important platform. As you mentioned, I think you launched in 2004 when Dr. Chris Gallagher founded the company. I know this is something that a lot of people think of telehealth as just something that a patient's calling in from their home. But I think what's so extraordinary about what you all do is you're even servicing health systems, as you mentioned, in rural communities, urban environments. So large and small systems all over the nation. I think you're in 50 states, is my understanding. And if someone needs a specialty, now they don't have to necessarily be flown to another system to get the care they need. Is that right?
That's exactly right. And we do serve predominantly health systems. We're not so much a patient to home model, but yes, we are in all 50 states. And frankly, when we started in the early years, it was a little bit more rural type hospitals. But what we're seeing now is that all hospitals, regardless of size and scale, need these specialists. And it really is market dependent, but hospitals are realizing that having telehealth can be, one, more cost effective, and two, ensure that they have all the services that a hospital needs to take care of every single patient. Because if you do have a gap in cardiology or in nephrology or infectious disease or neurology, then you're often, again, transferring those patients, and the patients probably are not having as a good outcome. So the quality is not as good either. So yeah, I mean, we're continuing to see the growth. I think that the telehealth space is going to continue to grow. There's just a lot of physician shortages. And if you've seen the news lately, there's over 750 hospitals out there that are at risk of closing. And telehealth can substantially help all of those hospitals by providing the specialists to make sure that they can keep their patients local and they don't have to drive an hour or 2 hours to the larger urban center, right?
And also maybe they have keep them close to their family so their family can see them while they're getting care. That's just, you mentioned some of the specialty areas. You mentioned cardiology, behavioral health, nephrology. Is it pretty vast spectrum of specialty care that you cover?
We do. We have 8 service lines, which is pretty robust in the industry. Most of the telehealth companies are one specialty, sometimes 2. There's a couple that do multi-specialty. But yes, we are, again, the largest and with 8 different service lines: neurology, behavioral health, cardiology, infectious disease, pulmonary critical care, nephrology, hospitalists, and MFM.
Interesting. So you're an enterprise platform, which I think is very significant as you framed it at the beginning. Is there Describe the difference between how you're able to serve a rural practice, but you also serve some of the largest systems in the country in big urban environments. You're able to do both.
Yeah, what we've seen, especially in the last couple years, is while a lot of hospitals were searching for telehealth individually, the ones that are part of the larger systems really needed it as well. And so what we see a lot of more bundling and type of services, more corporate level type decision making on services. And like I said, it can really reduce the number of transfers for the health system. It can reduce the cost. It can increase admissions because they're retaining more. And frankly, it's a great system approach. I come from the hospital world. I was CEO of a number of hospitals before joining Access TeleCare. And as a hospital CEO, you need to have those specialists, you need to have those doctors. And so, even if you're in a rural hospital or if you're in an urban hospital, if you don't have those specialists and you don't have them on call, then you're often, again, transferring patients. And that's just not a practice you want to get into. One, it's just not as good patient care. And two, again, keeping those patients local is better care for them, better outcomes, better for their family members. And not only that, but when you play it further, when these community hospitals close, they're often the biggest employers in these towns or these areas. And so if these hospitals close, then there's a massive loss of jobs. And we've seen towns really go under because their hospital closed. So keeping them open is really vital. And telehealth has proved to be a big opportunity when it comes to those, not only from a healthcare standpoint, but from an economic standpoint for towns.
Yeah, and it's so you're improving the care, you're also reducing costs for the system, but it's also an important revenue stream that you're making sure they maintain within their rural system rather than having to transfer those patients out to a different place.
It all starts with great quality and a great patient experience, and we provide that. But yes, there is the financial benefit as well. Again, if those hospitals are able to retain those patients locally, they're able to retain those admissions, retain those surgeries, the financial improvement is significant. And we've seen that in many case studies that we can get into on where hospitals were deeply in the red and they brought on telehealth for a number of service lines and they were able to turn that around and get back in the black and stay viable and stay open.
You mentioned your background as a CEO of many systems. I think that's just really helpful and compelling. Is it true you were actually a customer at one point of Access Telecare? Can you just give a little insight to what you saw when you were on the other side as the customer, and then how that's impacting your thinking now as the leader of Access Telecare?
It's a very interesting story. Back in 2008, I was a community hospital in Miami, and it was more of an inner city hospital, and we didn't have a ton of specialists, and we wanted to do a primary stroke center, and we only had one neurologist at the time, and that neurologist didn't want to take call. So for a primary stroke center, you have to have 24/7 coverage, and so back in 2008, telehealth was kind of starting. I've always been an early adopter in technology, and we learned about this company, Access TeleCare, which was called Specialists on Call at the time. And we brought them in, and it was wonderful. We were able to overnight, it took a couple months, but we were able to overnight keep all of those neurology patients, open up our primary stroke center, and we saved a bunch of lives by getting patients TPA at the time, which was the clot busting drug. For neurology patients and stroke patients, time is brain. So every second that the patient has a blockage, they're losing over 1 million neurons. So we were able to keep those patients local. We were able to take care of them. And then they had better outcomes and were able to return to their normal lives and their families. And so when I was being recruited for this opportunity, I knew very well the work that Access Telecare does and did and what the scale could be. And so for me, the opportunity to be a part of telehealth with the direction of telehealth and where it's going, the opportunity to help so many more patients than just being a hospital CEO and helping the patients in one community. Again, we can impact the patient care of an entire nation in all 50 states. And so that's pretty powerful and exciting. That's why I'm here. And that's why I am a staunch believer in telehealth. And I've seen it save lives.
Extraordinary. And you're already covering, I think, over 200 million Americans, which is just extraordinary. We mentioned all 50 states, which is, I think, really important. What's your, obviously, the company was founded 20 years ago. technology is moving and continues to move so quickly. We're in the new age of AI. How are you all thinking about the future and how you're integrating AI into making your platform even better today?
It's an exciting time, especially being part of a physician service company that's also a technology company. And so our software and hardware are some of the best in the business that have been evolving over the last 20 years. And often our clients opt for the use of our software and hardware, and they absolutely love it. So that is, again, top notch in the industry. As far as AI, we are leaning in heavily, as a lot of other companies are as well too. We believe there's a lot of opportunity in terms of our decision making, in terms of data sets, in terms of clinical care. And so we are piloting a number of programs now. And again, as you're seeing in the news, a lot of companies are really leaning super heavily into AI, and then they're backtracking. We're taking a more of a pointed approach. We've got three major projects in flight that are, one, going to increase efficiency, two, lower costs, and three, really help our clinicians, our doctors, our APCs get on screen faster, take care of patients, and really triage all of those consults on a real-time basis. So it's amazing what AI can do. We're really at a point where we've implemented a number of things, and then there are several more in flight. So it's going to be an exciting next couple of months as well.
Awesome. Yeah, I think maintaining that trust and credibility as you're launching new features, new technologies, absolutely essential. You're in growth phase. You're growing rapidly. Something's working. I think it's for the reasons you described. It's helping systems. It's helping patients. It's changing outcomes. Walk us into the future. You're a year into or not quite a year in, 9 months into your tenure. What's the future look like? Where are you going? What types of organizations should be reaching out and connecting with you as you're looking to scale?
Like I said earlier, the growth was very strong. More and more systems are reaching out to us. And again, it goes hand in hand with the physician shortages we're seeing. And a lot of physicians and APCs are collecting again at certain hospitals, and there's just not enough of them, right? And frankly, a lot of the younger generation don't want to be on call 24/7 or be on call for 2 or 3 weeks at a time, right? So they need backup and they need support. And ultimately, it's just better patient care. So for us, we're continuing to try and partner with all of the health systems on where we can. They tend to have different gaps in coverage depending on the facility, depending on the market, but there is a lot of opportunity out there. And so, yeah, we're just continuing to try and provide fantastic patient care, great client services, and just take great care of patients ultimately.
It sounds like from things you said earlier and from what I know, like this is a really big moment as well as opportunity to save a lot of the rural systems that are too many are closing. But hopefully this is a chance to kind of keep people local, keep people regional, and still open up access to the critical specialties and care that they need without having to drive or be flown around. Where do you see the trends going over the next decade? Do you think we're going to be able to maintain more of these systems? Are you optimistic? What are your thoughts?
I'm definitely optimistic on that. The reason I am optimistic is because we have a number of hospitals that we work with that have four, five, six different service lines. And I hate to use this term, but it is in vogue is a virtual hospital situation where the hospitals can't afford to pay for all these specialists, but they can afford to pay for telehealth and again, have the services local. And for your straightforward, more medicine, emergency type situations, having specialists there available via telehealth is a great solution. And then if they have a more major issue or require surgery, then the hospital can send them somewhere else or transfer depending on what's going on. But to be the first line and to have all these virtual specialists, we've seen it where hospitals can do exceptionally well and continue to thrive. Now, getting the education out to all the rural hospitals and all the hospitals that are struggling, it's a challenge, right? Some of them have never used telehealth. Some of them have, and some of them don't understand the power and the cost effectiveness as well as the potential to benefit financially. Yeah, that's part of our challenge is getting the word out, how we can help, getting those case studies out on what does it look like to become more of a virtual hospital. But we're seeing that more and more. And so fast forward 5 years, I think there's going to be more and more hospitals like that. I think some of them will shrink in size a little bit and be more virtual. But again, take care of a wide net of patients with a lot of different comorbidities and specialties.
Speaking to some of those leaders of different systems that maybe haven't used telecare services yet or telehealth services yet, what would your lessons learned as well as thought, what do you want them to know and understand putting back on you've been a CEO of systems like theirs. What do they need to know? Why should they be looking into these types of platforms?
They need to know that we're really, especially at Access TeleCare, just an add-on to your existing medical staff. We work in your EMR. We're really just an extension of your physicians and your APCs. And so really it's being able to not have to recruit specialists that need to move to your area. You've got specialists at the ready that are licensed in your state, that are privileged in your hospital, that are, again, part of your medical staff. So it's very easy. Not only that, but a lot of the historical pushback, and telehealth was really accelerated through the COVID situation, and that really brought a lot to the forefront. But the typical pushback has really been from a lot of medical staffs worried about telehealth and not being a physical presence there. But what we've seen in 20 years is that the medical staffs, once we're in there, they love us. They love our clinicians. They love having the backup. They love the notes are in the EMR when they arrive to do their consult. It truly is a partnership. And so I would call those worries unfounded. And in almost every situation, once hospitals move to a telehealth situation, they often never go back because they realize how great it is. So I think that trend will continue.
Wonderful. Where should people reach out? Where should leaders of these systems and institutions be connecting with Access TeleCare?
You can find us on our website, accesstelecare.com. Our phone number's on there. You can reach out to me. I'm on LinkedIn, not hard to find. If we can be helpful, let us know. Or if you just want to chat or get some type of consultation on your services, your market, and what the needs could be, we're happy to help with that too. But yeah, we're easy to find and happy to help.
Fantastic. And we'll put links in the show notes. Joshua DeTillio, thank you so much and for the work you're doing and carrying the torch. Dr. Chris Gallagher, the amazing company that he founded. And we're just so excited to have you part of the startup health community and really to see the impact you're making on tens of millions of people's lives and a lot of communities, a lot of health systems all over the nation that really need these types of solutions. So thank you so much.
Thank you. We've got a great team of clinicians, of doctors and APCs that really make the difference. And so I'm proud to represent them and be part of the team. And let's continue taking great care of patients. Thank you very much for the time.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace, this is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.